breathing free and easy. That's what we all want, right? For people who suffer with sinus issues, breathing free is possible. Joining us is Dr. Wells from Columbia Breathe Free Sinus and Allergy Centers to break down some common sinus issues and solutions for them. Thanks for being here.
Thanks for having me, Madeline. I'm excited.
Yes. So I know you've got a lot of experience dealing with those common sinus issues with your patients.
I sure have. I've been in practice over 25 years now. And during that time, I've treated all types of ENT patients, but I have just seen the impact that chronic sinusitis has on my patients. And so for the last 12 or 13 years, I've really had a passion and focused on providing and helping develop the most effective and minimally invasive treatments for patients with sinusitis. So I've had the opportunity to help develop and contribute to some of the technology and some of the protocols that we use to provide minimally invasive treatments to patients, and have been able to collaborate with many doctors and give talks at conferences around the country and around the world. And so it's been a great opportunity, but it's very exciting to what's developed in being able to address chronic sinusitis in patients and be able to do it in a minimally invasive way with in-office treatments.
Yes.
So patients with chronic sinusitis, the key to a sinus being healthy is that the doorway or the opening to the sinus has to be the right size and shape. And if that gets too narrow or blocked, then we start getting in trouble. And we start to have symptoms like a lot of pressure and pain and build up inside the sinus. And so patients can have sinus headaches, a lot of sinus facial pain and pressure. They certainly have a lot of nasal congestion and blockage, and often in times end up breathing through their mouth, especially at night. And so that mouth breathing really leads to snoring, even sleep apnea. So they don't sleep well, they're chronically fatigued. And their quality of life is impacted quite a bit by that. Their smell and taste can be impacted. And so studies have shown that the quality of life for people with chronic sinusitis is actually worse than people with chronic lung disease,
Really?
chronic heart disease, and even Parkinson's disease.
Wow.
I mean, I was really astonished, but it goes to show how much chronic sinusitis affects people.
It really does. And it's just such a debilitating issue to have, always constantly dealing with pain, pressure. And I'm sure it's such a wonderful thing to be able to work in this field where you help people. And it sounds like you're very much at the forefront of helping to develop and practice different ways to help too.
Yeah, it's been very exciting. People come to us and share all kinds of stories of their struggles. One study showed that up to 25% of people with chronic sinusitis suffer from depression.
Wow.
So there's that much impact on their lives because of these chronic symptoms. And so when folks come to see us at Columbia Breathe Free, we are so excited, and that is what we're there for, to help them get over that and get better, get them cleared up.
If someone is dealing with sinus issues, at what point should they come see you?
That's a great question. Certainly people should try medications and see if nasal sprays or oral antihistamines or decongestants can help, but they're really, again, just a Band-Aid, very temporary. But I tell folks, if you've had symptoms for several months and you've tried antibiotics and either haven't gotten better or you've gotten a little better but it keeps coming back, then it's time to come in and see us at Columbia Breathe Free. And what we'll do is we'll get a very careful history about what's been going on, and we'll take a look inside your nose with this little bitty camera. It slides just inside the nostril. It's very comfortable, but we can see the nasal and sinus anatomy very well, where the sinus openings are in the nose, and get a very good feel for how much inflammation is there, how much congestion is there, what the mucus looks like. And then we also get a quick, very simple picture of the nose and sinus. So we can see the sinus anatomy, we can see what those openings look like, and are they blocked or narrowed down, and put together exactly what's causing that patient's problems. And then we'll give them a treatment plan. And what's great is that we're able to offer them these minimally invasive approaches. So the minimally invasive approach is really based on using a little balloon to gently slip into the sinus opening and dilate it back to the normal size and shape. And that balloon comes right back out, doesn't stay there. It very gently opens the sinus. It doesn't remove tissue and cut and tear tissue like the standard approach to sinus treatment that many use today.
Right.
Because of that, we have very little bleeding. We have very little scarring, and so the sinus stays open. The patients recover very quickly. We're able to do it very comfortably and safely just with light anesthesia in the office, just light sedation. And so patients are able to get back to work or school in just a few days as opposed to 1 or 2 weeks with the more traditional approach.
So this sounds like a really great option for people who need it, and especially, when meds just don't work.
Absolutely. We're at Columbia Breathe Free, we're very excited. We offer patients same-day appointments because we know how much it's bothering them. And when their sinuses are acting up, we want to get them in quickly, and we're able to do their workup, whether it's an allergy test or the picture or looking in their nose, all those things that they need, we do that on their first visit. So they can get all that and walk out with a treatment plan right away.
Wonderful. Well, if you want to be one of those patients, what's the best way to get in touch?
You can look us up on our website at columbiabreathefree.com.
Well, thank you so much for sharing all of that. I'm sure that will be so helpful.
Thank you for having me, Madeline.